Every year, $14 billion are spent on personal water filters. And yet every day, 8,000 people still die from contaminated water. The technology we have today isn't cutting it. In the last 200 years, there have only been 5 different ways to purify water. Every treatment we have today is one of these 5 basic methods. But 2 years ago, I was working on a research project, and I tested a 6th. It's a new way to embed silver nanoparticles into filter paper, and the result purifies sewage water within seconds. Normally, this kind of performance costs at least $30, but this one costs just pennies. I knew that I had to bring this incredible technology out of the lab. So I partnered with our biologist Arden Shore. He's a PhD candidate from CMU and a fellow with the National Science Foundation. He has 12 years of research experience, and within weeks, we were synthesizing nanoparticles in his basement. We were ecstatic, but his housemates had some concerns. We knew we were onto something that could change the way we drink water. For the military, developing countries, boil water alerts, and outdoor recreation, a total addressable market of $18 billion. And our easiest market opportunity is the first 2 weeks after a natural disaster. Major floods and storms occur every other day, affecting 223 million people every year. $1.3 billion are spent shipping bottled water to people who are drowning in water. This is a broken market, and it needs disruptive technology. Rorus is the first company to deliver silver nanoparticle technology in our patent-pending device. To do that, we added our 3rd co-founder, Uriel Eisen. He's a compulsive inventor and builder who's led R&D for 2 companies and already has 4 designs in production. What we came up with is Dew, the device for emergency water. It's a portable personal filter that provides 1 week of safe drinking water for just $5. And we can manufacture it at a 90% gross profit margin. For the average disaster, we can replace 100 trucks of bottled water with just 1 truck of Dew. This is so important because FEMA took 3 days after Hurricane Sandy to start delivering bottled water. We can replace the massive storage facilities and the tremendous effort of shipping millions of pounds of bottled water, because these same hundreds of liters can now be carried by 1 person. Other designs that have gotten this far have failed because they're not easy to use. These are the instructions for chlorine tablets, and 8 organizations have told us they can't trust them because they're difficult to use and they lead to dangerous recontamination rates. These are our instructions. Dew physically prevents misuse and recontamination with our patent-pending design. With Dew, everything you need fits in your pocket. You can collect water in Dew itself, or you can pour water into the top of it. There's no waiting period, no measurements, and no materials required for a week's worth of drinking water. That's why people can use Dew on their first try, even across language barriers. So Dew is cheaper and more space efficient than bottled water, but it's also better than existing filters because it's safer and easier to use. It kills floodwater contaminants at a rate 1,000 times higher than EPA standards require, and it uses 50% less plastic waste than our competitors. We're starting in India because they have the biggest monsoons and the biggest flooding relief efforts in the world. Hundreds of aid organizations spend $1.4 billion on hydrological disasters alone, and we're already familiar with this region. We've developed strategic partnerships with the key actors, and I met them face-to-face when I was there in February for a usability pilot. Our first customer, EHA, delivers water to 50,000 people every year, a $250,000 opportunity for us, and we can expand to their close-knit network of partner organizations. These organizations already work together to deliver water and supplies at key locations around India. So there's going to be a tipping point at which many of them jump on board together, a $12.5 million opportunity in our first year of sales. To get to that tipping point, we need just 2 things for our customers. First, we're testing to World Health Organization standards. This is the seal of approval trusted by UN purchasers and aid organizations around the world. We don't need FDA or EPA approval. Second, our customers need to see that dew has been used safely in a disaster, which is why we're piloting with EHA this winter. From those first 50 organizations, we can expand across India, and India itself is the center of a larger region most affected by flooding in the world. Disaster relief is just the first step towards the entire personal filtration market, where the margins for military and outdoor recreation can be even higher. We are going to replace bottled water where other filters have failed. What makes us different is a new technology, a design that meets our customers' needs, the right team to produce it, and traction to scale it commercially. Water purification is a monumental problem that's been waiting for the right technology. Embedding silver nanoparticles is a new approach that's become viable for the first time in history. Someone's going to make a lot of money on this technology while doing a lot of good for the world. Rorus is that company. Thank you.